Hello, everyone, and good afternoon. I'm just very glad to have everyone here with us today at the Infinix Office Hours episode. Today, we're going to actually be discussing decoding the hidden cost of denials, and we'll also be going over some strategies on how to optimize prevention of those denials. My name is Stuart Newsome. I'm the Vice President of Marketing here at Infinix, and I'm so excited to share some insights and what I know regarding these hidden costs of denials going forward. Just a little bit about me. I've actually just joined the team in the last couple of weeks. Very excited to be the host of Office Hours. Been in the healthcare industry for about 28 years now, with extensive experience in the RCM platform, RCM side of business, as well as integrations with EHRs, practice management systems. So understanding AR, understanding denials management, and understanding how that information should be captured is something that's been key and near and dear to my heart for many, many, many years. So I just want to reiterate that this is heavily a Q&A session. So we want to hear from you with some questions. Just insert those into the Q&A box and we'll get to those at the end of the session. I'm going to give some brief commentary. Brief is an exaggeration. Maybe I won't be as brief, but I'll answer all your questions at the end once I'm done with what I have to say. And basically, want to get started with, it all begins with revenue integrity. I'm a big believer in revenue integrity, and it really should be the goal of everyone who's trying to bring in profits for their practices or for their organizations, because revenue does equal profits. So maintaining that revenue integrity should be your goal. And when I speak about integrity, it's one of those now in the industry. Revenue integrity could mean a lot of different things to a lot of different people. But to me, and what it really stands for is the security of your profits, the fortification of your revenue, making sure that everything's going to work with a sense of consistency and that there's some continuity, if you will, to the entire process, with aim or the end goal being to maximize those profits. And it all has to do with a phrase that I coined called achieving continuity. And achieving continuity is basically the coordination of efforts between everyone that has to do with the care continuum in your RCM workflow. That includes clinicians, it includes compliance staff, it includes billers and coders, obviously. And the entire staff has to be one towards this goal. And the goal should be also to improve efficiencies for secure and appropriate revenue. And if everyone's not in the same boat, rowing in the same direction, you could have some problems, right? There's often a lot of disruptions that could cause a lot of catastrophe to that revenue integrity complex. So one of those major issues comes in the forms of denials and rejections. And everyone knows this. I'm not really stating anything new or having an aha moment here, but denials and rejections have been a huge problem for many, many, many years. And I've been doing this for about 28 years now. And it seems that the top denials are always the same type of denials, anything from prior authorization, patient eligibility, even provider eligibility. Obviously, coding inaccuracies are always an issue. And in timely filing, I mean, I can't believe timely filing is still a problem in this day and age, but it is. Inaccurate claim data, using incorrect modifiers, I guess that could go under the category of coding inaccuracies. Improper bundling edits. And bundling edits, that's been around since 1996. Everyone knows about CCI. Well, that's been around for at least 28 or so years, 27 years, and we still haven't got that right in a lot of different practices. And then, of course, it all began with the payers, and all the payers have different policies, and those policies change, and they change at different cadences, at different frequencies. So it's very important that you keep up with those policies, and that's really the crux of it all, or at least one of the cruxes of it all. So, and I really feel that when it comes to denials and rejections, we've all been conditioned in the RCM universe, if you will, that denials are just a way of life. That this is the way we got to live with it. That we just have to accept it. But do we? These things are fixable if we really want to fix them. We're capable of fixing them. The problem is, are we willing to fix them? And I believe that when you uncover some of the things that maybe you don't are there every day, then you can actually lean towards, okay, how can we correct these issues and correct these problems? Now, I know denials are never going to go away. You're never going to get to a 0% denial. There's going to be always denials will always exist. So I'm not saying we want to do away with any denials management processes, but I think there's ways that you can improve denials management processes, and just make sure that you're going to optimize those workflows. Again, achieving continuity. I'm probably going to say that a lot of times during this commentary. Um, but it all begins with some perceptions about typical KPIs that most RCM solutions or denials management processes will utilize. One of those KPIs is the first pass claim rate. This is a very popular way of measuring whether a claim is clean or not. It seems to now be the only measure in some people's eyes as to whether or not it's a successful claim. Now, some first pass claim rates will be anywhere from 97 to 99%. Now, you see this in some marketing material for clearinghouses, PM systems, maybe even RCM solutions out there that will have a part of their marketing material that, hey, we have a 97, 98, or 99% first pass claim rate. No one ever has 100, right? So, but to me, I look at that and I'm like, well, how does that correlate with another KPI, which is the denial rate? Because typically, if you look at it on average, and this is a stat that comes from MGMA as well as HFMA and some other HBMA, some other associations, but on average, the national average, at least for denial rate, can be anywhere from 15 to 20%. So does that really correlate? Does the math really add up with first pass claim rate? So if first pass claim rate is the barometer that for a successful claim to go through, then my denial rate should be anywhere from 1%. That's just something that doesn't make sense to me. I guess you want to look at this in reality that the first pass claim rate is kind of like someone being dressed appropriately for a party. You're invited to a party, you go to this party, it has a certain attire you have to wear. So you're accepted into the party based on your appearance. However, once you're in the party, your behavior could get you thrown out, right? So that's exactly what's happening with the claim. The first pass claim rate is merely that all the fields are entered correctly, it has the correct information, all the boxes are checked, everything looks good. This is a clean claim, really only from the data is there. There is some data there in the claim, and it's sent in appropriately based on how it's dressed, if you will. However, the behavior of that claim, once it gets into and goes through the adjudication process, gets it kicked out and it becomes a denial. So I think a lot of people don't realize this, pay more attention to the denial rate rather than the first pass claim rate. Now, again, the first pass claim rate is very important because if you're not dressed right for the party, you're not going to get in to begin with, which means you're not going to have an opportunity to be adjudicated and have some fun at the party, by the way. Now, some other stats that really revolve around that underlie the 15 to 20% are also a stat that's very astonishing is that of that 15 to 20%, only 60% are ever resubmitted. And that's another national average. And of those resubmissions, only 18% is never collected. And so that's astonishing. So you're never going to really truly get all the data that you need or all the money or revenue that you need if you have a denial that's involved. So the best remedy is to make sure that the claim is going to be correct the first time through. Now, that brings me to where we now want to focus on some of the hidden cost of those denials that many healthcare professionals and RCM professionals are not really aware of. Um, Now, this is the cost of what I call reworking a claim. And we all know that a part of the denials management process is obviously you get the denial, you got to work the denial, right? That's a phrase that everyone's very familiar with. But what's the cost of working that denial? And are you paying attention to that cost? Is that a factor that you're putting into the equation as to the efficiency of your denials management processes? Now, again, on average, uh, it's about $25.20 to rework a claim. Now, again, that's some stats that's been agreed upon from MGMA, HFMA, some other organizations out there. I didn't just pull that out of the air. Now, there are many variables to this. Again, this is just a national average, but the variances may depend upon your specialty, may depend upon if you're the size of your practice or maybe your hospital systems. Some are much higher. Averages for reworking a claim is about $150. Some are as low as $15, which is pretty good to rework a claim. But it really depends upon the efficiency of your organization to make that a much lower factor. And we'll get into that. Now, to determine your cost to rework a claim, you need to really consider some factors here. Obviously, the number of staff that's involved. How big is your staff? And we all know with the Great Resignation, that's still affecting a lot of people out there, that many organizations are understaffed. The time spent reworking those claims, even if you have an adequate staff or not, there's a lot of time invested in that. And then the process is being used. Are you using processes that have been used for the last 20 years, or are you updating those processes based on advances in technology? And are you utilizing the right tools to leverage everything you can out of the revenue in reworking those claims? Now, also consider this. It costs on average, again, that same average that correlates reworking a claim for $25.20, just to file that claim the first time is typically $6. So reworking a claim, it's really a total investment around $31 on average. So when you really step back and look at that, it really is to benefit to make sure the claims are right the first time. And I know everyone is intent on doing that. That's why there's so much opportunity in denials management these days in the RCM. And that's why there's an RCM cycle to begin with. It is just a necessary evil that you have to rework those claims. It's a necessary evil that you have to manage those denials. But becoming more efficient at it is something that should be your goal. Again, achieving continuity. So let's just look at this from a practical standpoint. So let's just say your denial rate is, and you can pick whatever denial rate you want. And after I go through this exercise, you can go back and play the video and do it yourself. I do strongly encourage you to do this yourself because it really will open your eyes as to how much revenue and money is actually being spent reworking a claim. And then you need to deduct that out of how much money are you actually receiving as a net, so to speak. So at a 12% denial rate, let's just say that you're submitting 5,000 claims a month. That could represent anywhere from a 15 to 20 provider practice. So this essentially means that you're expecting 600 of those claims to be denied or rejected. Now apply your costs to rework those claims, and we're just going to use the $25.20 that equates to about $15,120 per month to rework your claims. Now, when we add the total investment to resolve those claims, when we consider the fact that the first time through it was $6, that number jumps up to $720. So that's almost $225,000 annually. It comes up to, if you're a 15 provider practice, I think that comes up to about $15,000 per provider. So that's a lot of money. I don't know if everyone really realized that or not, or took a step back, but it's just a good exercise to be sure that you uncover what is this true cost. Then I know you may be asking yourself, well, how do we reduce the cost of denials? Essentially, there are two things that you should do. There's obviously a lot more, but for the sake of time and trying to get to the Q&A, we're just going to cover really two main things. And obviously, one is you want to reduce the cost to rework your claims. And how do you do that? Well, you really have to take a long look to your current denials management processes. And you have to understand it's an analysis or an audit, if you will. Audit your own process. Don't trust the process. See if there's any means for improvement. Go down to each staff member, see what they're actually doing. You have to consider the touches that your staff is making. Take a look at your process that everyone's been trained on for so many years and be sure, is this really the most efficient way that we have to have our denial management of our denials? So instances like calling the insurance company. or running down the provider to get some clarity on the encounter from the EHR or the medical record, investigating each denial to determine the root cause. I mean, the list could go on and on and on. Just consider every single thing that a staff member has to do to remedy that denial. And then you obviously have staff salary. That's a part of the equation, what that cost would be when determining the cost to rework a claim. And then you also have technology. And I don't mean necessarily advancements in technology. We're going to get to that in just a, but you need to audit your technology. Is your technology antiquated? I've experienced many EHRs and PM systems out there. Maybe you're a user of one of them. It's like the 90s called and they want their user interface back. I mean, they're just not up with the times. There may be some things going on in the background, but you need to ask yourself, well, are they up to speed on the regulations? Are they up to speed on their data sets? Are they up to speed on any edits that they may come with? How often or do they provide updates? So these are questions that go beyond your staff, but also to your partners and vendors that you're actually working with. Now, just a brief break on this step number 2. And I just want to speak very briefly about the advancements of automation, AI, and machine learning. It's really come to a point now where these technologies can really assist the denials process and ease the tension and time involved in management. You can easily automate commonly known root causes or administrative corrections or mundane routines that your staff doesn't have to worry about anymore if you can write it in an automated process. And I know that's very scary. A lot of people are still on the fence with AI. There are those who are very curious and want to go in full bore, and there are others who are like, well, let's wait and see what the rest of the world's going to look like. And then there's that fear factor: are we replacing people? Well, not at all. I like to look at it as you're augmenting the work that your current staff's doing, not trying to replace your current staff. It's how can you make your current staff more efficient and work smarter, if you will, if you pardon the cliche, not necessarily harder. You still work harder and smarter. So with that, with these automations, that leaves your staff to work on some of the critical and harder cases that need their attention. So they're not wasting their time on things that are just mundane and routine. So you have unattended automation and you have attended automation. The unattended automation, those are the things that they're just simple tasks that will eat up your day. They will eat up your time. You know what I'm talking about. You know those tasks that I'm referring to. Then you have attended automation that will bring to light those things that your staff needs to pay attention to. And it's not necessarily correcting it, but it may be offering suggestions, maybe offering information that they need to make an informed decision on how to remedy that denial. And then there's also a step in here that really blows my mind, and what I really like about what Infinix offers in their AR denials management platform, and that is the predictability of revenue recovery from a denial. So I just want to imagine, if you will, yeah, everyone has analytics, and the analytics certainly in this AR denials management platform is really great analytics. You can certainly drill down by payer. You can certainly drill down by CPT code. You can certainly drill down by provider. All the analytics are there, and it kind of gives you a micro universe of that data at each level that you go to. But what really is unique that I haven't really seen anywhere else is the predictability aspect of this, of profitability. So we'll actually analyze the data, analyze these claims denials, and determine which priority you should go after and work on. Now, typically in the traditional denials management process, anyone who's worth their merit in the workflow will prioritize which claims to work based on, first of all, is there a timely filing, a deadline priority? And then second of all, which are the highest charges? What money is going to those charges that I need to work? Well, and actually with the predictability that this platform offers, is this going to tell you the probability of those collections. So you may have, say, a couple of claims that are $10,000 in total, and you may have some claims that are, say, maybe $5,000 in total. But it's going to let you know, well, you have about a 30 to 50% chance of collecting these $10,000 group of claims, but you have, say, a 98% probability of collecting this 5,000. So then you're actually making more efficiency of your time by zeroing in on what the probability and the high predictability of receiving that revenue back. Now, I'm not necessarily the expert yet on that technology, so do encourage you to contact Infinix, and we'll be happy to give a demo, give you some more information on that. But it's really slick. It's going to be a game changer. Now, the second thing that you can do to help improve the cost of reworking of claims is something that I've been preaching for many, many years, and that is denials prevention. If you can prevent denial from happening to begin with, then that's going to obviously lower your denial rate. So what I mean by that is it's really going to take analyzing your entire RCM workflow, not only the back end, because everyone thinks RCM is all about submitting claims and getting the claims out the door and the claims denied. Again, that expectation that we're going to get those denials, that conditioning that we've had to expect that. And then we're going to work those claims. But it really begins when you're scheduling the patient. So from scheduling to patient registration, to understanding the payment that the patient's going to owe up front. Are you collecting that payment up front? Do you have payment estimations in place to where you know exactly what the patient owes? Do you have prior authorization when scheduling? Do you understand the patient's demographics, their patient eligibility that's going to be offered? So you'll know exactly how much money the patient owes you and how much money the payer owes you. That's very important. It all starts in the beginning, not at the end, because at the end, in many cases, it's too late to get the money anyway. But then also during the encounter, what are some things that you can take care of as far as E&M coding, as far as the appropriate use of modifiers, applying certain edits at that level, where yes, even at the clinician level or prior to the clinician level, where it's actually, or post clinician level, where it's actually going into the PM system, maybe some charge capture situations. So I call that kind of middle ground, kind of more an encounter, more patient encounter type of a segment where you can apply a lot of the edits that have been learned from the denials management process and then build those what I call smart edits. You want to leverage those root causes. You spent all this time and energy to determine what is the root cause, then put that to work for you. So you don't repeat the process. If you figured out what the root cause is, yes, put that. You can automate that. Make sure if it's able to be automated, so you don't repeat that process. But you can also kick it earlier on in the workflow to where it could be, and you want to think about this, could I turn it into a smart edit for me and make it work for me rather than be me? Now, so I know what you're thinking. You're probably thinking, yes, I want to reduce the cost to rework a claim and also want to start denials prevention. And I can say the best way to do that, and you've heard me speak this in different ways. There was a theme that I basically articulated here, and that was, analyze your workflows. You want to make an assessment of your denials management processes. So basically, you want to perform what is an RCM checkup. And Infinix has this actually. They call it the RCM health check. And it's essentially a diagnostic assessment that will reveal the state of your RCM, if you will. You'll receive some actionable data, some information points, if you will, that give you some powerful analytics. And these analytics will provide you with informed information. They make you have an informed decision that has rapid insights into what are your shortfalls, what are your top denials, what are your aging causes, which payers are paying more appropriately than others. And yes, you may have a decision to fire some payers. I've had some providers who it's been in the long run their benefit to not take certain payers because they were just low paying payers, and they also weren't very frequent. You typically want to look at your top five payers and work those denials. So this will give those analytics for you. This will be a launching point as well predictive assessments that I was talking about earlier. So if you're interested, I just urge you to please, contact us, and we can get you started ASAP with an RCM health check. It'll be well worth your while. Many clients have found this analysis very useful, and it's very revealing for them on what it can really do. And then again, just making an informed decision so they can uncover, where are the problem areas. In a previous life, I actually went through this exercise, didn't have the luxury of RCM health check and the analytics and the technology that Infinix offered. But I can tell you from experience, you'd be surprised at what you could uncover. I've had clients tell me that, oh, my denials management process is just top notch and everyone follows it. We spend a lot of time articulating it. We spend a lot of time developing it, and it is in place and implemented. But at the end of the day, we found out, well, then why are your denial rates so high? Why do you have so many claims that are aged 120 days out? Then these were serious questions that we needed to have answers to. And when we really peeled back the onion, we found out that, well, one, their software was outdated. Again, the 90s called, they want their UI back. But also their software wasn't receiving timely updates. So they really didn't understand the cadence and the update process. And many times they weren't updated at all for many, many quarters or many, many years. And also they found that users were skipping certain edits or skipping certain processes because to them, the name of the game was, let's get the claim out the door. My job is to submit the claim. And if it passes the first pass claim rate or just, then that's good enough for me. And this was causing denials, even though these processes were put in place. They were actually relying on the RTP report that incurs additional staff expense. Because again, that's going to end up you got to rework the claim if you're waiting on that RTP report to come back to you. That's the return to provider report. Now, not following up in a timely manner, this is that timely filing issue that they just let claims sit there, and when they expire, they were past those refiling deadlines. And then they also discovered that there were some claims that were paid, and if a claim is paid, then it's not going to show up on the denial, right? But they were well under the allowed rate, so they didn't update their fee schedules. Their fee schedules were so out of date that they didn't really realize that they were underpaying themselves. And the insurance was gladly going to pay the amounts that they submitted, but they couldn't go back and recoup that because it was already adjudicated. Now, that was a lot of high level information regarding the hidden cost to rework a claim. But I'd like to allow some time for some questions. I just want to kind of stay and look, as I encourage everyone to put in some questions. As they come in, I'll be happy to answer them. If I don't have the answer, I will certainly find the answer for you, and we'll get started with that. And the first question is, in that previous life, was your team able to resolve, and what were some of the strategies that worked? Oh yeah, that's an excellent question. And the strategies really were long-term strategies. And it really wasn't so much that our team was resolving it, because we were a software company. We weren't a consulting company. We were just trying to reveal how our software could help in their processes. But it really helped them uncover some of the things that they needed to resolve on their own. So very easily out of the gate, one of the things was, let's make sure the software is updated. That was an easy fix to make sure that they were on schedule with that and make sure that they were using the software in an appropriate manner. And then holding everyone accountable. It was that achieving continuity definition that I gave earlier. They really wanted to understand who was, not doing their job, and that it just wasn't acceptable. And having everyone on the team hold everyone accountable. But that's a great question. So we had another question that came in here. It says, what are some common challenges or that organizations face when attempting to prevent denials at the front end of the revenue cycle? And how can they overcome these challenges? Well, I think, and particularly, I like the fact that this question was worded with the front end, because typically no one thinks about the front end when it comes to denials. again, it's always the back end, the claim submission team, so to speak, that gets held accountable for, well, why did this denial occur? But again, it goes back to continuity and accountability. Sure, everyone's on that same team, rowing the boat in the same direction. Um, some of the challenges was the software. The EHR didn't really work well with the PM system. They were two different systems. And we live in a world, quite frankly, in healthcare where there's always been this divide between the clinical and the business of the finance side. And you have to find a way to bridge those two together, and where everyone understands that what you do on the clinical affects drastically what's done on the business side. And it all centers around coding. I've always said that coding is a language. It's the language that insurance companies use to determine what happened at the encounter. And coders are translators. And if the translation is off, well, then there's going to be a lot of misunderstandings, misinterpretations, which may lead to denials. So, biggest challenge is making sure that the communications are there and everyone's on the same page with, and making sure the technologies can align. Another question: what are some top of a huge denials backlog? Wow, that's a great one, and we may need to you may need to call in and speak to one of our personnel regarding this on how Infinix can help. But I really think Infinix with the AR denials management platform can really help with that, because that AR, but let's take the 120-day cycle, for instance. And I just heard a story today, and I forget the name of the organization, but they were in a 120-day cycle, just had a lot of claims out there. And I believe that maybe it was within a month. I have somebody to correct me on that, but they recovered about $6 million just from the 120-day aging. So the steps involved in that is just looking at, again, using some predictability as to which claims you need to work first. A lot of times the backlog is the backlog because you can be overwhelmed. It's very overwhelming. And by the time you get to 120 days, the sentiment is you're not going to collect that at all anyway. You might as well get ready to write that off. So to prevent it from writing it off, you want to take the time to prioritize which claims to work. And doing that manually is very cumbersome. If you could do it manually, then we wouldn't have a 120-day problem. So it's very imperative that you use technology like Infinix has, that you can actually look at and apply that predictability uh, uh, format or technology that's there using AI, and it's very robust to then prioritize which ones to work, and you just chip at it. Because at the end of the day, your staff only can work a certain number of denials per day, maybe 30, 40 denials a day. I don't know, everyone has a different number, but you can determine that number. So you want them to work on the ones that are going to get you the most revenue. And that's actually going to help reduce that backlog faster and quicker than you know it. And don't get sucked into, oh, this is a big number. I got to really work this. So that may eat up all your time and, just be like a, a, a leech that's just not going to ever go away. Here's another one. It says, what would your advice be to a provider that had a really high number of denials attributed to coding reasons? Yeah, I would have to say, and it would depend on what the coding reason is. There's all kind of coding things. I'm a big believer in diagnosis coding. At diagnosis, typically everyone looks at CPT codes as being the driver for revenue. And certainly it is, because the CPT is what has the RVU value attached to it. But the diagnosis is the reason for the visit, and the diagnosis has to be correct. And then now in these day and age, you're having to use additional diagnosis to better articulate what happened with that visit. Social determinants of health is a great example. Z codes traditionally never got you paid, and so no one ever used them. But now, particularly with COVID or post-COVID, as well as with value-based care, as well as E&M coding, Z codes, social determinants of health are becoming an increasing value in that regard. If it's a coding reason that has to do with E&M codes, yeah, it's certainly education on the E&M documentation guidelines, but also be sure they're trusting their critical judgment. I think most providers undercode because that's another thing, issue out there that the claim may have gotten paid and it has an E&M code on there that's say a level 3 and it could have been a level 4 based on the documentation. Well, then you're not getting paid what you should have gotten paid. The claim got paid. It's not going to show up on a denial report. But I think a lot of times the denials could be for overcoding, could be for non-covered services. Maybe they're using the wrong CPT code. Could be some bundling edit issues. Could also be modifiers. Modifiers can be a huge issue, coding reason for why denials pile up. Using modifiers appropriately and how they correlate with the place of service. And then another thing, this ties back to timely updates. Data service matters. And if you're submitting a claim that had a data service where the updates or the data or the regulations were one set of rules and one set of data or information, and now you're submitting it with a on a data service that should have had that information, then you may see an increase in denials because you didn't update the software in a timely fashion. So hopefully that answered your question as well. All right, so and here's another one. It has to do with, I guess, the RCM health check. But for organizations considering an RCM health check, what specific areas or aspects of their revenue cycle should they pay particularly attention to when identifying inefficiencies and gaps? Okay, so that's the whole point of the health check. Once you perform the RCM health check, then you will see what specific areas and aspects of the revenue cycle you need to pay attention to. That's the luxury of that health check. The whole purpose it's give you information and have you have an informed decision on where you need to focus your attention, your time, and your energy on. You're going to get metrics, obviously, with the analytics. You're going to look at, percent of net revenue. You're going to look at overall margins. You're going to look at, your write-offs, your denials, your aged inventory over 90 days, over 120 days, wherever the case may be. But you're going to be able to drill down into that information and understand, okay, where are the problem areas? Where do they really lie here? And so again, for the one who asked this question, I strongly encourage you to go through with the RCM health check because then you'll be surprised and be very, very pleased. I guarantee it. If any other questions? So I see here is another question. It says you mentioned the importance of accuracy in EHR coding and PM systems to prevent denials. How can organizations ensure data accuracy across their various systems, especially to complex healthcare environments? Now, this question, I believe, probably has to do maybe for hospital systems that have multiple EHRs, which is and then those complex healthcare systems. So, yeah, either at there's a lot of these EHRs that they're not exactly agnostic. So, and don't maybe even they're supposed to have some interoperability. They don't really share very well with others. There's a lot of proprietary information, proprietary features that they all may bring, even though they're all supposed to be part of interoperability, particularly if they're performing anything with MIPS or value-based care. There are certain requirements there that have to be met with that, but still, at the end of the day, they may not play nice, and that's why having a platform where you're bringing all that data into one place that you can actually see and work all the information is really going to be critical. Infinix actually has the ability to do that. The platform is agnostic, where it can bring in data from multiple EHRs, multiple PM systems. And if that's your case where you're dealing with multiple platforms, you can have one place where all this data resides, and you can actually look at those analytics and those predictive analysis and many ways in which you're working those claims with certain work queues where all that is worked within inside the Infinix platform. Okay, great. Well, if there's no more questions, again, very happy to be your host today. Looking forward to many more hosting of office hours. If there's any questions or comments, please don't hesitate to reach out to us. Really appreciate everyone for joining us today. And we'll see you next week, which next week we're actually going to be speaking on CARCs and RARCs and remittance advice. So not sure if we can drop that into the chat for registration just yet, but if not, be on the lookout for that. But we want to get into a cadence where we'll let you know live during the current session what we're going to be covering the next section. Not exactly sure what the official title is going to be yet, nor the description, but I can let you know we are going to be talking about uh, deciphering CARCs and RARCs as well as looking at remittance advice notices. That's really fun stuff. So I know you want to sign up immediately. I think it has been dropped in the chat. So if you want to click on that, go ahead and register for that. And we'll see you then. Give you a few more minutes to register and click on that link. But then we'll be happy to answer any more questions in the next second or so. But I believe we may be done. All right. Within that, then I'll happy to everyone sign on today, and we'll talk to you next time. Thank you.